Have you heard the saying an apple a day keeps the doctor away? Well, that may not be completely true. Consuming all fruits and vegetables is good for your health. Cruciferous vegetables in particular is what will be discussed in this video. So, you might be wondering, what are cruciferous vegetables? These types of vegetables are part of the Brassicaceae family, including vegetables like kale, broccoli, bok choy, cabbage, cauliflower, arugula, turnips, and Brussels sprouts. These vegetables contain chemicals known as glucosinolates and S-methylcysteine sulfoxide. It also includes sulfur-containing cancer-protective chemicals. Glucosinolates, mainly found in the Brassicaceae family, are secondary metabolites that are beneficial for our health. During the chewing and digestion process, cruciferous vegetables are broken down to form biologically active compounds like glucosinolates, indoles, and isothiocyanates, also known as ITCs, among others. Indole 3-carbonyl and sulforaphane, a type of isothiocyanate, are the compounds most commonly and often searched for anti-cancer effects. Cancer is among the top leading causes of mortality in the world. For women in the US, 32% of new cancer diagnoses in 2024 are projected to be breast cancer, and 7% of new diagnoses are projected to be colon cancer. For men, 8% of all cancer diagnoses are projected to be colon cancer. The death rate from cancer-related diseases is expected to double by 2030. Lifestyle factors stand out to be one of the main causes of cancer, and as many as 35% are linked to an individual's diet. So, that brings me to my research question, which is, do cruciferous vegetables lower the risk of developing colon and breast cancer? About 1/3 of the risk of colon cancer has been associated with processed food, red meat, and foods of this nature. Colon cancer can begin either in the colon or rectum, which makes up the large intestine and part of the gastrointestinal system. Many epidemiological studies show that daily intake of sulfur-rich vegetables helps greatly reduce cancer formation. In this clinical study, researchers examined whether incorporating sulforaphane, a phytochemical belonging to the isothiocyanate family found in cruciferous vegetables, prevents colon carcinogenesis in both mice and human subjects. In the animal study, azoxystrobin, a chemical carcinogen, was administered to 6-week-old mice, inducing colon tumors such as microscopic aberrant crypt foci, also known as ACF, and macroscopic tumors. Subsequently, the mice were fed with an ordinary diet in either the absence or presence of 2,200 parts per million sulforaphane glucosinolates for either 8 or 24 weeks. All mice were then sacrificed. The number of ACF and macroscopic tumors in colonic mucosa were counted. Comparisons were made between mice who were given a diet that included sulforaphane glucosinolates and the mice with a normal diet without sulforaphane glucosinolates. In the human study, 23 subjects were recruited from patients with colon polyps diagnosed by colonoscopy. Rectal mucosa in each participant were stained with 0.15% methylene blue. The number of ACF was counted using magnifying colonoscopy. Later, all subjects were fed 50 grams of broccoli sprouts containing 128 milligrams of sulforaphane glucosinolates every other day for 6 months. Another colonoscopy was then performed. The number of ACF was counted and compared to the original number of ACF before broccoli sprout consumption. In both studies, it was found that sulforaphane intake led to reduced development of ACF and macroscopic tumors in mice or patients with colon cancer. In both studies, it was found that sulforaphane intake led to reduced development of ACF and macroscopic tumors in mice or patients with colon cancer. What can be taken away from the study is that sulforaphane intake from cruciferous vegetables like broccoli causes changes in the intestinal microbiota that may also play a role in chemoprevention against colon cancer. Moving on to the second type of cancer that cruciferous vegetables may prevent is breast cancer, which is the most common and the second leading cause of cancer-related mortality among American women. In the early 1990s, researchers acknowledged chemopreventative activities of cruciferous vegetables. Evidence of their potential preventative role against various cancers, including breast cancer, was found. As I mentioned earlier, cruciferous vegetables are rich sources of glucosinolates containing isothiocyanates and indoles, which have chemopreventative properties. Evidence from both in vitro and in vivo studies suggests that isothiocyanates and indoles may inhibit breast cancer from developing through the following mechanisms: regulating the activity of phase 1 and phase 2 enzymes, inhibiting cell proliferation, moderating the expression of estrogen receptors, altering the metabolism of estrogen, and suppressing cyclooxygenase 2. This case control study aims to assess the association between intake of cruciferous vegetables and breast cancer risk. A total of about 3,000 patients at Roswell Park Cancer Institute in Buffalo who participated in the Patient Epidemiology Data System, also known as PEDS, from 1982 to 1998 were selected for this study. Controls were randomly selected from a pool of about 8,000 potentially eligible patients who were diagnosed with conditions other than cancer. The PEDS questionnaire involved data relevant to breast cancer risk factors, including information on demographics, tobacco use, alcohol consumption, reproductive history, medical history, and a food frequency questionnaire assessing usual diet in the few years before diagnosis. This questionnaire assessed intakes of fruits and vegetables, including cruciferous vegetables. The data collected was then evaluated. Combining all the time periods, cruciferous vegetable intake was inversely associated with breast cancer risk, with a significant dose-response relation with a p-trend of 0.0006. Compared with those with the lowest intake, the highest intake was associated with a 32% reduction in the odds of breast cancer. Similar significant inverse associations and dose-response relations were observed for broccoli and cauliflower intakes. Intakes of cabbage, Brussels sprouts, kale, and other greens also showed inverse associations with breast cancer risk, but the associations were not significant. So to put it more simply, this study suggests that incorporating cruciferous vegetables into daily diet reduces the risk of developing breast cancer, especially with cauliflower and broccoli. While an apple a day may not exactly keep the doctor away, incorporating a generous amount of cruciferous vegetables into your diet may help prevent breast and colon cancer. Remember, what you fuel your body with greatly affects how it will respond in return.